Does HRT cause cancer? Technically, being on hormones does increase your risk of some cancers, but also can decrease your risk of other cancers. Menopause itself doesn't increase the risk of cancer. It's just that technically cancers are more common as people age, and most cancers occur in patients that are 55 years and older. The cancer that most women are concerned about when starting HRT is breast cancer. And studies have shown that if you take a hormone replacement therapy that has both estrogen and progesterone for at least 3 to 5 years, there is a modest increase in your baseline risk for breast cancer. However, if you do not have your uterus and you've had a hysterectomy, if you take estrogen alone and you take it for at least 7 years, they showed that there was no increased risk of breast cancer in those patients. So the information is mixed. Also, if you take a hormone replacement like estrogen alone and you still have your uterus, that will increase your risk of having uterine cancer. That's why we prescribe the progesterone along with the estrogen to help keep that uterine lining in control. Now, on the other hand, hormone replacement therapy does decrease your risk of having colon cancer. Of course, all these other cancers are multifactorial, meaning many different things can affect them. So we also take into account what your family history is, what your lifestyle is like. Are you a generally healthy person? Do you take care of yourself? What is your diet like? There are so many things in the environment that can affect our bodies and that can increase our risk of cancer, namely things like smoking and exposure to carcinogen agents. But hormone replacement therapy itself does slightly increase that risk. So that's something important to take into account when you're considering going on hormone therapy.